Being healthy isn't just about your physical well-being. You need to consider your mental health as well, and that's exactly what they do at the Behavioral Health Center. Here's Dr. Larry Kubiak.
Over the centuries, we've learned that there is a very important connection between physical and mental health, that you can't really separate the two. Your mental health and your physical health are so intimately intertwined that you can't affect one without influencing the other. So that's what we try to incorporate in our approaches here in dealing with what's going on with people.
So Dr. Kubiak, what are some of the concerns that you're able to address through the Behavioral Health Center?
Well, in regard to mental health, primarily depression, severe depression, major depression, to the point that someone is a danger to themselves or others, the variety of anxiety disorders, post-traumatic stress disorder, generalized anxiety, schizophrenia, bipolar disorder, substance abuse. There's certainly a lot of comorbidity, so it's not unusual for people to have several of those things going on at once.
So the team that's been gathered here, what does that consist of?
Well, we have a number of people. We have a treating psychiatrist who's in charge over all of the team, but we also have psychology, we have psychiatric nurses and social workers, we have mental health techs on each of the units. We also have expressive therapy, which includes art therapy, music therapy, and we also have pet therapy. So all of the different modalities are very needed to help provide the best care possible for a patient.
So how would someone become introduced then to this center?
Well, they can either come on a voluntary basis or an involuntary basis. If they felt the need for inpatient care, they could come on their own for assessment. But sometimes, unfortunately, it's on an involuntary basis through what we call the Baker Act. And law enforcement may be involved, and they would be instructed to bring them here to the hospital where they'd be evaluated. And if patient care is needed, then we would arrange for that either at our facility or elsewhere, or make arrangements for outpatient care.